It was our first week at Harvard Medical School. As we sat in our opening anatomy lecture, only images of white, male, slim bodies were shown. We felt invalidated and overlooked as people from underrepresented communities and as students aspiring to care for patients of diverse backgrounds. With committed faculty, we decided to form a working group to address this structural lack of representation within anatomy and within medicine at large.
The imagery in Harvard's anatomy curriculum and European-derived medical training curricula across the world is rooted in ideas of patriarchy, racism, colonialism, and other forms of bias. Research has shown that representation in medical education matters. For example, Black and Latinx patients receive inadequate pain management compared with white patients, supported by a myth among half of sampled medical students that Black people's nerve endings are less sensitive than those of white people.
Women receive less bystander CPR than men when they have cardiac arrests outside of the hospital due to false biomedical notions about women's bodies. Anti-fat bias has been identified in more than 1/3 of sampled medical students, contributing to poor care for over 70% of people in the United States. Lastly, data have shown that medical schools frame aging as a variant, reinforcing bias among doctors who often fail to understand and attend to the needs of older adults. We seek to historicize and deconstruct these harmful categories of so-called normal and abnormal bodies.
Our team is an interdisciplinary, international, and intergenerational working group with members from a variety of social, ethnic, and cultural backgrounds. The team includes core anatomy faculty members who have led efforts at the intersection of curriculum, scholarship, and clinical care, as well as HMS student leaders from the Black, Latino, Native American, Asian, and LGBTQ+ student groups. We also have representatives from HMS Student Council and the Racial Justice Coalition.
Our mission is to address the lack of anatomical representation by creating an innovative digital platform storing a centralized inventory of inclusive anatomical visuals.
Our platform will center people with diverse bodies, people of color, people with variations in body fat, intersex people and people of diverse sex development, people with differing abilities, people of all ages, people with body modifications and changes due to procedures or trauma, and more. It will be open source, allowing for communities to represent themselves, peer-reviewed to ensure anatomical accuracy, and accessible across educational institutions to address a national and global need.
We begin our process of developing the platform by assessing the landscape of anatomical representation in past and present medical education. In partnership with other organizations, we'll produce materials that help students grapple with biomedicine's troubled history. Resources such as concept videos will integrate historical examples to explore the ethics of representation, the agents and structures that influence anatomical representation, and some of the problematic legacies still playing out in anatomical curricula.
Throughout our process, we are developing strong partnerships within the university, including the MGH Museum of Medical History and Innovation, the Department of Global Health and Social Medicine at HMS, the Center for the History of Medicine at the Countway Library, the Department of Anthropology, and the Harvard University Art Museums.
We will continue to expand our relationship with the HMS Office for Diversity, Inclusion, and Community Partnerships. In particular, the Sexual and Gender Minorities Health Equity Initiative and the Educational Outreach Programs, as well as external organizations such as Fenway Health.
Innovations for diverse representation in medical education, especially in anatomy, are long overdue. For many students, the donor body is our first patient, and the Anatomy Atlas is our first detailed exposure to the human form that we will ultimately care for. The significance of these initial encounters cannot be understated, nor the implicit biases we perpetuate in students by continuing to have only thin, young, white, male bodies represented in the curriculum.
These biases in medical education lead to inadequate health systems, contributing to current crises like the disproportionate impacts of COVID-19 on Black and Latinx people in the US. Our platform is a critical step in addressing inadequate representation within medicine, raising the standard of care for marginalized patients in the US and globally.